Questions about COVID-19 vaccine shots for kids 5 to 11. How long will we need to have booster shots, and when we'll finally be out of this pandemic? Canada's Chief Medical Officer of Health, Dr. Theresa Tam, joined me for a one-on-one interview to discuss how we are doing as a country. Are you nervous about the uptake, the hesitancy with getting these kids vaccinated? And if that's an issue, could we potentially be looking at wasted doses?
I just want to remind parents, of course, that vaccination of these 5 to 11-year-olds as an additional great layer of protection is for their own protection and their own personal benefit. What I've seen is that kids of this age group now has the highest incidence because some of the older age groups have got vaccinated, and they're the only age group right now, at least last week, where the incidence is on the rise.
I understand the benefits, and you could list about 20 benefits for parents, and there will still be some who say, I'm not doing it for my 5-year-old. I'm the opposite. I can tell you I have a 5-year-old, and he will be first in line to get vaccinated. But there will be people who say it's just not going to happen. So how do you convince those people if you want to convince those people?
There's certainly quite a good large group of people who are enthusiastic. Others are still waiting. So it's this group that we really want to make sure they have the right information. It's okay to ask questions and maybe wait a bit. I think as a pediatrician, as a pediatric infectious disease specialist, what I would say is, if you're not ready to make the decision today, come back and talk to your pediatrician or healthcare provider, because that's normal.
I want to get to booster shots, and a lot of people are wondering, how long are we going to be having to do these booster shots? Are we still talking? Are we on track to say every year we're going to have where immunity wanes? Is it going to be every 6 months? Can you project that?
Not at the moment. What we can tell you is that, particularly against the Delta variant and over time, the vaccine effectiveness against severe outcomes has continued to be strong at this point, but it's the immunity against infection or milder illness that it seems to be dropping over time. It's really the people with higher risk conditions that we're focusing on. At the moment, we have not recommended vaccines for younger boosted shots for younger age group, but we're still monitoring that.
Should we be changing our strategy in acknowledging that COVID-19 can linger in the air? We're so used to masking, but should we be focusing more on ventilation? Should we be focusing on those environments? How do you answer that?
I think that the first thing to do is make sure that you got your HVAC system checked out. It's getting great outdoor air exchange as much as you can. But there are simple things that you can do even in the winter in Canada. If you can't go out and do a lot of the activities that you want to do, is just opening the window for short periods of time every few hours, particularly if you had someone in your house who isn't part of your household, and keep the size of your gatherings small.
Everyone wants to know when. When can we say this pandemic is behind us?
I'm looking towards coming out past this winter as a period of time where we can see a bit more stability.
One of the reasons why Dr. Tam sounds confident is because of our vaccination rate. Over 85% of those 12 and older in our country are fully vaccinated. You can watch the full interview on breakfasttelevision.ca. For City News, I'm Melanie Ng.